There's a warning tonight for parents from a father whose little boy is in the hospital battling a serious illness tied to COVID-19, even though he never tested positive for the virus. And he has not shown any symptoms whatsoever. Joe Hankey shares the family story of COVID.
For the past month, 4-year-old Quincy Poole Jr. has been at Children's Healthcare of Atlanta battling MIS-C, or multi-system inflammatory syndrome, in children.
A cardiologist told me my son was like the top 3% in the country. One of the top 3% of the worst cases of MIS-C they ever seen.
Quincy Poole Sr. says the condition attacked his boy's heart, lungs, kidney, and caused a blood clot.
So he was on the brink of organ shutdown.
Swelling in his arms required surgery. Now Poole Jr. is learning how to use his hands again and showing signs of improvement.
Now he's walking, getting out of the wheelchair.
Poole Sr. says his family never tested positive for COVID-19 and never experienced any symptoms. But after bringing his son to the hospital, doctors found he had COVID antibodies, meaning his son was exposed at some point to the virus. Doctors say in rare cases, COVID-19 leads to MIS-C.
We're still trying to get a better understanding of which children are more likely to be predisposed to having MIS-C.
Dr. Andy Shane with Children's Healthcare of Atlanta says when COVID cases overall spike, MIS-C cases have increased weeks later. Since last May, children's doctors have diagnosed 240 MIS-C cases.
The MIS-C symptoms start to present between 3 weeks to about 6 weeks after the initial COVID infection.
Abdominal pain, vomiting, rash, bloodshot eyes can be MIS-C symptoms and a reason to call your pediatrician. Trouble breathing, prolonged chest pain, confusion, being unable to stay awake, serious stomach pain are severe symptoms and rare but need medical attention.
We have seen a trend towards less severe cases.
Shane says less severe cases may only require a short hospital stay and minimal treatment. Poole Sr., though, says his boy may need 3 more weeks in the hospital with rehab to follow. And Dr. Shane tells me the best way to avoid MIS-C is simply just to avoid COVID. So even as adults are now being vaccinated for the virus, that means you have to keep continuing to follow those safety measures and avoiding crowds to help your children limit their exposure.